afternoon. Good afternoon. Welcome, ladies and gentlemen. Magic 95.9, your man Ryan the Lion here. We are live to talk about a great event coming up to help out our community. And it's all about the Medicare, Medicaid fraud, abuse, and scams on Older Adult Summit. This is just a sneak preview to get you some great information about this upcoming event. And to help me talk about this big event for the community are my esteemed guests this evening from the Baltimore City Health Department, from the State Health Insurance Assistance Program. You guys got a lot of titles going on over here. Okay. Also, the Senior Medicare Patrol. Please first help me welcome Pamela Massey. Did I say your last name correctly?
You said it correctly, yes.
Awesome. Program Manager, Baltimore City. Also joining us this evening, Julia Schreiber from SHIP, SMP, and MIPPA Director. I told you it's a lot of acronyms rolling around today. And of course, Cassandra Brown, volunteer and counselor for Baltimore City as well. Welcome. Thank you for joining me this evening, ladies. How are you?
Thank you.
Wonderful.
We're glad to be here.
Yes, I'm glad you all are as well, because there's always a good tell when there's a problem. When people start throwing events about a problem, it lets you know that it's a big enough problem that it needs some awareness and it needs some attention. And we have one of those problems in our city, probably in a lot of cities all over. But Medicare and Medicaid fraud, big deal in Baltimore.
Absolutely. So I'm just going to start by saying that the Senior Medicare Patrol Program, what we do, we empower and we assist Medicare beneficiaries and their families, and also caregivers to prevent, detect, and report their health care, let's say, suspicion of activities. It could be fraud. It could be an error that was made, or it could be somebody excessively using, let's say, an item to keep charging their Medicare account. And this is a common problem and a real bad problem, not just in Baltimore City, but in the entire state of Maryland and really across the nation. The good news is we do have the Senior Medicare Patrol Program and the SHIP program, which is the State Health Insurance Assistance Program, in every jurisdiction. And so there is this program all across the nation, because it is really a national program. Very important. We really want people to be aware of it. We want people to be aware that it's a free service. We provide real intense counseling. We go far and beyond trying to help people to solve like billing problems. We help during open enrollment season. If there is a problem, a billing issue, we work with that person to get that resolved. And sometimes it's a lot of times it could be a scam issue, but we do escalate it up to CMS, the Office of Attorney General. So it depends in this case by case basis. But one of the things that I really want Baltimore City Medicare beneficiaries, their families, and caregivers to really start doing is become very vigilant when it comes to their healthcare appointments, and to make sure that they are being charged for what they really went, to the office, what their appointments was about. Because a lot of times people do not pay attention to those summary notice, and it's real important, because if they do find that there's any errors or scams, they really need to call our office, which is the Senior Medicare Patrol Office, as well as SHIP, Senior Insurance Assistance Program, and that number is 410-396 2273. That is the way you're always going to access this program. You're going to always call and ask for a SHIP counselor or a SMP counselor. And what will happen is they will put you on a call list, and we will call you back. So,
excuse me.
No, I'm sorry. Go ahead, Miss Brown.
I was about to say, one of the areas that you can do from your home. You get your quarterly report, your explanation of benefits, shows you what medications you used, what the charges were, what your out-of-pocket costs were. Same thing with your with the notice for your medicine. I mean, for your medicine, for your health care, the Medicare summary notice. I got something recently and said that I had gotten Whirlpool. Said that I had gotten into a Whirlpool, and I never got into a Whirlpool in my therapy. They'd use a device and whirl. So anyway, I called, and the answer was get in touch with the provider because they want to give them an opportunity to make a correction, because there are fines for billing mistakes. There are
Absolutely.
fines if they're not corrected. I didn't know that. Well, I know it now. So I called to say to them, are you sure you want to bill Medicare for Whirlpool? When did I get in a Whirlpool? Well, you better believe they recoded that correctly, that it was just a little device that gave a massage to the area of my body that I needed to relax the muscle. But the difference in the price was thousands of dollars over a year. So that's the things we can do as patients, as our civic duty to watch out for costs, because that's coming off of your Medicare benefit and it's coming off the tax cost for Medicare.
Hmm. Which always lead to the higher premiums and the cost of our medical insurance. And we've all feel that. So this is why we're trying to get everybody involved, and for everybody to be vigilant with your health care insurances, because if this is what people are doing, we are paying for that.
We are.
And if this is what we're doing, it is driving the healthcare cost up even more. One of the things that I do want to share is this wonderful event that you're talking about, and that is going to be at the Zeta Senior Center on June 14th, and it's going to be at 4501 Reisterstown Road. And we do ask that if you attend, and we hope that many people will attend, to give the Zeta Center a call so they can register. And when that day comes, they will be there. We've got some exciting guests that's coming directly from CMS, which is Center for Medicare and Medicaid. So we have direct representatives that's coming there, from there, to present to our older adults or whoever's planning to attend. We have someone that's coming from Social Security, and they're coming from the Delaware area. The CMS person is coming from the Philadelphia area, which that is our region. And we have also someone coming from the Office of Attorney General, as well as the um, insurance administration. That someone's coming also for that. We're going to have a host of vendors. We're going to have some giveaways. So we would love to see you there, and because we need to help you, and we need the help from you so we can do our job. Again, our job is free. We do not charge. We do not sell insurance, so we don't get any kickbacks. So these programs is all for Baltimore City constituents.
Right, exactly. And if I might add something, Pam, is that one of the things that we also can watch out for to prevent scam and things like that is, just as you were saying, they used to give events and invite people and say to them, for the first 25 people who come in and leave their Medicare number, Social Security number, and their birth date, we will give you a $25 gift card. That's a scam. First of all, you
Exactly.
don't just write your Medicare number down at an event, so anyone can use it, or your Social Security number, or your birthday, because when you do that, that's money to the scammer. That's
Hmm.
outright abuse right there. And
Hmm.
I want to reemphasize, just for our listeners, is that there is a difference between Medicare and Medicaid. But if we don't do our part, we're losing money. You're losing out of your pocket. You're losing out of your copay. You can actually jeopardize your benefits. Like, you have so many opportunities to get a wheelchair or a scooter or some other durable medical equipment within so many months. And if you allow someone to just abuse the system, just send you a wheelchair or send you a scooter or whatever, and they haven't met you, they haven't come into home, your doctor didn't request it, then you've lost the opportunity to when you need it because they're going to
Mhm.
say you already ordered one. So you have to be careful. If someone starts offering you something for your Medicare information, you need to become very alert and say to them, I'll have someone get in touch with you, or say, I'm not interested, or call your doctor's office and say, did you order this for me? And from there, they will tell you what to do. But you can also call, as Miss Massey said, call the city and ask the question, does this sound right? And that number is the 410 for any Medicare questions, any Medicaid questions. And if I might add at this moment, I would like to just briefly tell you the difference between Medicare and Medicaid so you'll understand what it is. Now, Medicare is the federal health insurance program for people who are at least 65 years of age, or if you're under 65, you have a disability, you have Lou Gehrig's disease, which is um, ALS. Let's see if I pronounce it correctly, amyotrophic lateral sclerosis. And if you have a renal disease, end-stage renal disease, we also say kidney disease, that makes you eligible for Medicare. As I said, it's a federal program, and usually you have a red, white, and blue card, and that you need to protect, just like as a credit card. The other one is Medicaid. Medicaid is in the United States is a government program that provides health insurance benefits for adults and children with limited income. And it looks at the resources. It is a joint effort between the federal and states. And in Maryland, you may hear the name Maryland Medicaid. It might be referred to as medical assistance. And so that's what that is. If you have any confusion about what it is, what you have, some people have one, some people have both. You can always again call into the SHIP S&P office and get clarification and how your benefits can be um, secured and how you can get the health care that you need.
Awesome, awesome. And I'm thinking just like about our senior community. They're a target. They're like easy prey for these scammers,
Yes.
especially with technology nowadays. It seems kind of just unfair with all the things that they're able to do. So I want to implore our community to come on out and get educated, get informed, all the different ways to detect, like the flyer says, detect, okay, protect, and of course, report. We definitely got to get this information out to our community. So I know the event is coming up again, so please let's get that information out one more time.
It's it's June 14th at the Zeta Senior Center, 4501 Reisterstown Road, Baltimore, Maryland. And we do need to contact the Zeta Center so you can register. That's where all the registration is going to be at the Zeta Center. I've got to find the number so I can announce that number. Um, does anyone between Cassandra or
Yeah,
I'm
why you
sorry.
guys do that?
I'm
Why you guys do
sorry
that?
because it's on my flyer and I don't have my flyer. And maybe I do. I don't have my flyer in front of me. I apologize.
No, no problem. And
Um,
while you take a look for that, we do have a question. And maybe Julia, you can help us with this. If you don't have Medicare or Medicaid, are you still eligible to come to the event and get information, or do you need to be a part of these programs?
You do not have to have Medicare in order to come to the event. There's actually a lot to learn, and eventually we'll all be eligible for Medicare. So it's good to learn now. And there's also tips that translate to even if you have a different type of insurance. That is great for people that have Medicare, but also if you might have a loved one in your life that has Medicare, or maybe you're a caregiver for somebody that has Medicare. So everybody is welcome, and there's plenty to learn.
Yeah, definitely. That's something we have to think about as well. Family members, somebody in your family is probably at a stage where they are getting this kind of assistance, and we need to look out for them. Another question in our chat: where can I go for the same services if I live in another state? Good question.
I'm happy to answer this one as
Yeah.
well. So as Pam mentioned, this is it's a statewide and a national program. So if you're in a county or city other than Baltimore City, you can go to aging.maryland.gov/SMP and look up the number for your the local office in your county. If you're listening in from another state, you can go to smpresource.org and you can look up the number based on your state.
And of course, we are here talking about Medicare, Medicaid fraud scams for our senior, older adults, and something that I'm realizing is happening way more often than I thought it was. Even though these are government programs, you would think security would be top notch, but these scammers, they don't care. They are getting in people's information however they can. Again, the event coming up is all about informing our community: Medicare, Medicaid fraud, abuse, scams. The summit is coming up. What's the date? June 14th.
June 14th. And the phone number, and I do apologize for that, but it's 410-396-3535. That's the number that we want you to call if you are interested in attending that event. And I really advise, whether you're a Medicare recipient, whether maybe you're helping your parents, maybe just to learn about it yourself. It's real important that you attend, start tuning in, and become very vigilant. And again, to register for the event for June 14th, the phone number is 410-396-3535. Now, if you need to access the program for other things other than this event, that number will be 410-396-2273. That is the way the constituents access the SHIP program and the SMP program. And I mean, when I tell you, for anything, don't think that any question is, well, I don't need to call them for that. Yes, you do. Because a lot of times we will hold back and we think that the question is not good enough, like too small, but that's what we're here for. We're here to help you. We're here to explain to you. We're here so you can understand your benefits, and even if it's just tailored to what you really need. That's what we're here for. We're here for the open enrollment season. We're here for billing, scams, everything. So that number you will call is 410-396-2273. That is our Maryland Access Point line. That's our call center. That's where you would lead into everything else. But again, the event for June 14th will be at Zeta Senior Center, and that is on 4501 Reisterstown Road. That phone number is 410-396-3535, and we really need you to register for that. We have to avoid walk-ins due to the size of the room that we have, and so we really need you to register in order to attend the event. We will not turn people away, but that's what we need you to do. That's what we need you to do.
Now, there was a question that was up. It says, I have people calling the house all the time saying they're from Medicare. How do I know who is real and who isn't? It's a very good question. Is there something that you could ask, or is there a tell sign?
The tell sign is Medicare never calls you. They
Unless you call them
never.
and are expecting a call back, right?
Yes. Huh? I'm sorry.
Unless you call them and are expecting a call back, you will never
exactly.
call.
But just to automatically call you, no, Medicare does not operate that way. Neither does Social Security. So people need to be aware of both of those entities. No one calls. They if they need to send a letter, they will send a letter, but still no one calls from either of those entities. That is something that you would have to initiate because you have a situation, a problem that you want to find out. So people need to be aware. If anybody's ever calling them, telling them, I'm calling you from Medicare, and asking you for things, or even just to say, we just want to make sure your information is correct. Do not answer any questions.
Hang up.
Yes.
Yeah.
We used to say hang up.
Yep.
And skeptical of offers of free items too, like genetic tests. They'll say that or durable medical equipment like a knee brace or something. If it's too good to be true, don't trust it. Even if you say no, I don't want it, monitor, as Cassandra said, monitor your Medicare summary notice, your explanation of benefits, because that charge might still come through, and you want to report it if it does.
And I want to add, if you don't mind, real quick. Sometimes when people are trying to scam people, they're giving them information like the name of the company, their name. We want that information so that can be reported, because just like they said, Cassandra said, they'll get fined, different things like that. So we have to help to protect our health insurance that way. You get a name, even when it comes to some insurances, with the broker. Brokers, that the agents, that their license, they are not supposed to say, take this insurance, push them into any type of insurance, other than give them options. They should not recruit. What should happen is, if that constituent or that beneficiary is interested in your insurance, they're to go and ask directly, not for insurance companies to come to recruit to join my health plan. So that's another important thing, that if that happens, then you need to report, and you're more than welcome to report it to our office, so we can escalate and put it and send it where that information needs to go as well. So again, if it's going to be our office, during those times outside of the event, it's going to be 410-396-2273. That is our call center, which is Maryland Access Point. And our division is the Baltimore City Health Department, Division of Aging Services and Community Support. For the event that is going to take place for June 14th, the number is 410-396-3535. We look forward to seeing everybody there. And that's going to be at 4501 Reisterstown Road, and that's Baltimore, Maryland. There's plenty of parking, and we just can't wait to see you guys so we can give you even more information.
Yes, absolutely. I mean, it's so amazing to really know that all of this happens, and it happens so frequently, especially to our senior, citizens. Is there any community or demographic that is more susceptible to this? Does this happen to any demographic or set of people more than others, or is it just widespread everywhere?
It's pretty surprising how, across the board, people are susceptible to it. I think when it comes to Medicare Advantage marketing, Pam was touching on this. People that have extra help, which is a benefit that helps pay for the cost of Medicare, sometimes get targeted a little bit more by those marketing pushes, because they're able to change plans more frequently.
Mm-hmm.
But it's pretty shocking how widespread, those scam calls are. People saying, I have your Medicare number. We're going to send you this service. And we're all susceptible to being duped.
Yeah, absolutely. Very
Right.
easy, especially if you're trusting and you just don't think that that's going to happen in a program like this. Like, they wouldn't do that. So very important to get this information out to our seniors. We have a couple minutes left. I would love for each of you to just say something about, again, inviting people out, make sure they come out, and let's wrap it up before you get to 3:30, which is 4 o'clock, which is only a couple minutes left here. But definitely a big event coming up, and we want the people to come out. So Julia, before you go, any last words to get the folks out?
We'd love to see you there, meet you in person. Lots to learn. And thanks for having us.
Absolutely. Pam?
I concur with Julia. I would love to see you guys there. I think this is going to be a very informative event. And I think that this is information that people just need and need to know that you have some place to call and a group of people that really care and want to help our constituents.
Yes. And my girl, Miss Cassandra.
Just
Vol-
thank you. Just want to say quickly, watch out for the scams. It's seasonal. They're going to call you about flu shots. They're going to call you about COVID. They're going to call you about back braces. And you're going to learn more about that on June 14th at the Zeta Center. Invite your young people, whoever's helping you
Yes.
make decisions, be there or be square.
Absolutely. And before we go, let's give out the information about the event one more time.
Okay, that's 4501 Reisterstown Road, Baltimore, Maryland. That is the Zeta Senior Center. Please call 396 410. I'm sorry, 396 3535.
Hey,
Thank
ladies,
And
you.
I want to
mhm,
say thank you so much for spreading the information, spreading the love. We need it. And hopefully the community comes out in droves to get this information so we can continue to protect ourselves against those who are just trying to just take so much from people who are just a vulnerable part of our community. So we definitely look forward to this event, June 14th. A lot of big things happening, great information. So thank you, ladies, once again. And I look forward to seeing you guys on June 14th.
thank
Thank
you.
you. Goodbye.
Thank you. Thank you for having us.
Thank you.